I'm a pediatrician here in Des Moines. I've been here for 23 years. And my passion, my sort of specialty, although it's not truly a specialty, is kids with special health care needs. I was actually introduced to ChildServe 23 years ago by Dr. Saeed Hussein, who actually is the forefather of ChildServe as it is now. That unit specializes in immaculate care of children with really severe medical needs that can't really be cared for in their parents' homes. Most of these children are nonverbal, and they require many medical treatments and medications throughout the day to keep them healthy. So there's a really broad range of children that are cared for there. So some children were born with something wrong with their brain, or something wrong with their brain and their heart and their abdomen, and multi-system problems from birth, so from something genetic. We have children there who are blind and deaf from meningitis and never developed properly from that. And then we do have some children who are there because of trauma, and some children because of neurologic diseases that present as seizures but progress as developmental delays. Unless you are 3 nurses and a respiratory therapist and a play therapist and a rec therapist and an aquatic therapist and a physical therapist and an occupational therapist, a speech therapist, and a dietitian, there is no way that one mother or one set of parents could care for some of these kids. Not every pediatrician in Des Moines goes out to ChildServe because you have to do it outside the time that you spend in your office. So there are actually only 3 of us that go there every week to take care of the patients who live there. I think all of the doctors go above and beyond that take care of the kids there, and more so than the doctors or the nurses. To take care of these children, you almost have to go above and beyond because they can't tell us what's wrong. So particularly the nurses and the healthcare techs and the aides and the therapists there, they have to find every little nuance that patient can show us to tell me if maybe they're starting to get sick, or maybe they're starting to dislike something, or maybe they're hurting in a certain way. So it takes a lot of skill, and it takes a lot of patience to get to understand each patient to be able to keep them at their best health. Intellectually, it's very challenging to manage all their different medications and all their different medical problems without them being able to say, I hurt right here, or it's harder for me to breathe today. By mirroring the behaviors and the skills I've seen in the nurses, you do get to know these kids, and they really do have a subtle personality that you get to care for, and then you just want to make sure that they have the best life they can have. Some of the parents I talk to almost every week. Some of the parents I talk to just when there are changes going on with their children. Some of the parents don't even live in Iowa, but they have chosen to leave their child here even though they had to move for a job or something because of the quality of care that they know their child gets. And so that gives you a little bit of sense of pride that they know how well cared for their child is there. I've been there a lot when kids have taken their last breath. That's sometimes when you know what it's meant to a parent to have you there. Because you're there with them and you're consoling the parent as much as you're consoling the child. And they know, they see the compassion that you have for their child, and that if you can't be there every day for your child, to know someone else has that compassion, that's the gratifying thing. Because they are children, and they have feelings, and even though they can't express them and they can't speak. And so when they're alone, I wouldn't want to be alone if I was really sick. And I know their parents wouldn't want them to be alone when they're dying. And you don't spend a lot of time with your patient when they're dying. You spend a lot of time with them trying to keep them well. And sometimes it gets to the point where all you can do is give them comfort. And so to walk away at that point, I couldn't think of walking away at that point. So then you're in because you care about them, and to not be able to be with my child would kill me. And so if I can be there for somebody else in their stead and hold their child until they get there, or because they can't get there, then I'm gonna do it. Dennis does his job with the biggest heart and the most love for every kid there. And so for him to think that I deserve this more than him, the nurses, the therapists, it was kind of humbling to me. And I've said this to them, and I said it to Dennis, is I think the nurses are the heroes because they're there day in and day out all the time. And this is an extension of my job. My regular job I do at work is to take care of kids to the best of my ability. And that includes being compassionate for them and caring about them as people, not just as a patient, which is what I think I do at ChildServe. If you take care of a patient for 15 years, you know them pretty well. And you should care about them. So I don't really think what I do is that special. I think having to be there day in and day out is much more heroic than what I do. So I would back nominate them.